Hello my dear students, we have today with us Dr. Shalin Shah, who is rank 62 in NEETPG 2019 and hails from KM Mumbai. He is doing his internship now, which is not yet finished. So he is a very good inspiration for many of us who are currently pursuing the internship. We would like to congratulate you, Shalin, for such an excellent rank, okay, because we dream to have such ranks, which you were able to do being a fresher. Now, your story.
Okay, so I started my time with my experience with DAMS in the first as a foundation student. So at that time, I was very serious about making the notes, and I still remember that I attended almost all classes except one or two, and I remember the teachers, what examples they gave and what concepts they taught, because what they taught during that 1 year, it covered most of the final year topics also, which I was not well versed with. But when I read the standard textbooks, it was like a revision. I mean, like the first reading of textbook was a revision because the DAMS faculty taught so well in the first time in first. Then there were the test and discussion in the internship, and that was like a brush up for whatever concepts I had learned and whatever notes I made, because I had handwritten notes. I did not have the Xerox or anything. It was easier for me to recollect whatever finer points teachers might have said which I had missed to write in the notes, and so it was very helpful to sit there and listen to the lectures instead of just using some of my friends' notes.
So Sal, you are focusing on a very important point, that you made your own notes and you said not to take the notes of your friends. Yes. Now you tell me, suppose I am your friend sitting in the same class and there's a teacher who is teaching. Now both of us are writing the same thing. Yes. So why aren't you comfortable with my notes?
Sir, it's like I have read the textbooks and I retain some points, but there are some points which I tend to miss. And when I hear, suppose you say something important in PSM, some new update in PSM which I am not aware, I am going to star mark that thing, that this is something that I may not remember. I have not read it many times for my profs. And my friend will again have his own flow of ideas, and we may prioritize different things, different topics. Like for PSM, I was never very comfortable with the values, so I never paid much attention to values. Or for example, in FM, I was never comfortable with IPC sections. So I thought that maybe I should learn other things in PSM, maybe the recent updates, so I can answer those questions if I miss out on something like proteins in milk or something like that.
Yeah. So it's a very important point which Shalin has brought out. See, all of us have got a different thinking and a different way to present the same thing. So many of us who are trying to look into this video would be thinking, okay, we can take a shortcut by having someone else's note, not attending a class, and we can do about it. But he has made it very clear that it would not succeed. And see, listen to him, because he has got such an excellent rank, which itself speaks his clarity when he is saying that we should attend the class. Now Shalin, tell me next thing. See, you are an intern.
Yes.
You have hectic posting. I know KM is a hectic place. Now, still you cracked such a good rank. Okay. Now, another part of thinking is people say don't go to the postings. Now, your take. How does posting help you to get such a good rank?
Yeah, what I would like to stress is I had given AIMS exam. I have given NEET. There are some questions which are directly asked from what procedures you do, whether you have attended the rounds or not. Like AIMS had a question on steps of ABG. NEET had a question on how to interpret the blood grouping tests. So such things, even if you have not read, you have just seen in the words, you have just performed it once, then it would be a great help. So this basically reduces the burden on how much you have to learn. Or they are asking about instruments. AIMS had too many visuals about instruments and procedures. So if you have seen that on the patients, it's actually a good feeling in the exam. It gives us a confidence. Yes, I know this is only the answer. There is no doubt about it in my mind.
Okay. Now, Shalin, tell me one thing. The another barter which comes is the time. See, yes. When we do a posting, we invest time on it. Okay. Now, is doing a posting cost effective, time effective?
It's not very time effective. I mean, there are times when I felt that I have to stay 4 hours in the ward just to complete some clerical work. But at the end of the day, what I get means if I spend 4 hours, my resident is also impressed, and they are going to teach me something which I may have to spend another 3 hours to read from the notes. Or if I'm missing some, suppose say medicine lecture, I can ask my residents or my professors during the rounds to clear my doubts over that topic.
Okay. So importance is you don't skip it. That's what you would like to tell. Okay. Now, DAMS, the faculties. Okay. What is your view that which faculty impressed you the most?
For the faculties, I think Sumer sir has been the most motivational person. I mean, whenever I felt down that I'm not performing as per my expectations or I'm doing lots of silly mistakes, I used to listen to his talks which are there on eMedicos and YouTube. So he has been a support system. And as for teaching, I think you, Tushar sir, Sachin sir, I mean, your notes are only enough. We don't, even if we don't remember much of Park or, for example, psychiatry, if you don't know much, only your notes would be sufficient. And even 2 days before, we can revise that very quickly during exams, and we get direct lines from the notes. Okay. So even Dipti ma'am's notes, these were some of the notes which I exclusively looked at only those things, and whatever updates you used to put on the clubs. Like Diksha Sikri ma'am, she used to have a lot of updates. So they used to cover up a lot of the things which maybe I had skipped during my prof's studies because they were not IMPs. And DAMS faculty usually covered most of those things.
Now, you mentioned a very important thing, the DAMS club. How did you take the DAMS club? Because a very common notion is the club is on the Facebook platform and we get deviated to see XYZ things.
Yes.
What was your take?
For the club, I did not ask many questions. I used to just review whatever posts used to come. So I did not just check my wall. I used to go on the club and check what posts have come on the club. And the club also sends notifications if some faculty posts on it. So I used to religiously follow those updates because there are quite a few questions which are asked directly or indirectly from those things. And some of the doubts also, they were encouraging. Like if I'm reading something new, then I'll open my textbooks, I'll go back to Harrison or I'll go back to Robbins and see that, okay, I don't know this concept. Okay. So it helped me pick up fine points somewhere or the other. Okay.
eMedicos, the role of that in your
eMedicos, I used to use it mainly for the mop-up videos. They're very great. I mean, those are great and they're concise. Like in 15 minutes, the faculties give us a lot of information. And also the quiz questions that Sumer sir posts or Dipti ma'am posts, they're very good and they're mainly useful for Central Institute exams like AIMS and JIPMER. They usually ask direct questions from there.
Okay. Now, say all said and done. Now, this particular video is being heard by many students who have not done well in the exam.
Yes.
Who are like you, who are an intern and who are like you, or there are students who have dropped for a year or two. What is your message to them?
I would just like to tell you guys that you can still study for a year and you should focus on what subjects you know, and there are the short subjects like we have ANAT, we have ENT, Opthal, Psychiatry, Ortho. These are the subjects which you can revise in 2 to 3 days before exam, and they ask around 5 to 10 questions from each. And if you have revised them correctly, you can score 8 to 9 definitely. But instead, if you spend 1 month on reading medicine, and most of the people will solve them through patho, physio, pharmac. So in the end of the day, you are spending 1 month and you are solving only 15 out of those 30 questions. Because there are 10 questions that nobody is going to solve unless they have read Harrison, like they've gone on Harrison marathon or something.
Even if Harrison marathon, you cannot guarantee to know everything.
Exactly. Medicine and surgery both are unlimited subjects. So if you are repeating again, I would stress that you should not lose points on your short subjects. Medicine, surgery, if you lose, it is okay. It is acceptable because everyone is going to lose some questions. I mean, even the topper is not going to get 1200 on 1200 score. But there is obstetrics, there is pediatrics, and the short subjects, you cannot lose points over there because they are limited and most of the students will do those questions right. So if you are planning to do only like 12 subjects or 13 subjects in the year, you're not very dedicated or you get tired easily, then I would suggest those 12 subjects should be those short subjects.
Now, Shalin, tell me one thing, the exam.
Yes.
How did you take the NEET exam? Because that is a very important question which plagues every student, because they have like, it's a computer based exam, it was in the afternoon, this, that, number of questions to be attempted. How was your approach to the exam?
See, one thing that I felt while giving the GTs was if I'm constantly going through like ANAT questions or physio questions, they tend to get repetitive and I tend to commit more mistakes. So what I did during CBT 2 and NEET was I used to attempt 10-15 questions from part A, then I used to switch to part C, then part B. So it was like I was constantly refreshing my brain. I was jumping from anat to medicine to forensic to PSM, and so it helped me. I mean, it did not allow me to fall asleep or allow my mind to get stagnant during the NEET paper. And we have to keep a good space also. Like some questions we can solve immediately after looking at the options. There are some where we have to think, and it may not give us an answer even after thinking. Like we may be able to rule out 2 options. So I left them for a second review, and I solved as many questions as I could on the first attempt. Then I went for the second review where I had ruled out 2 options, and now I had to make an intelligent guess over one of the options. So in the end I could attempt around 295 questions. So
you got a score of?
My score was 920 on
920.
1200.
So see, if I calculate 920 is roughly 77%.
Yes.
Okay. And you say you attempted 295 questions.
Yes.
Now, roughly 77% if I say is near about some about 230 odd questions or 240 questions odd.
Yes.
Okay. So that means you in the exam actually might have got 260 or 265 questions correct, and from the negatives here.
For the negatives.
Now tell me one thing. There are many students who ask that, sir, when a topper guesses, he gets it right, but when we guess, we get it wrong. So you tell me, how do you used to guess in the exam? Or did you have so many questions which you didn't know and you had a blindside guess? Or there were very few which you didn't know and you went for a guess wisely?
If I compare the GTs, CBT and NEET, I can say that there were around 150 to 160 questions which I could attempt on my first go after attending the classes and TND and the notes. Then there were 50-60 questions where I mean, if the question was from medicine, but I could think that Patho and Micro would suggest answer C, so most likely the answer should be C. And it used to come out correct 75% of the times. And for the rest of the questions, somewhere or the other, I might have heard it during my internship, somewhere during the lecture I have heard it, but I may not have revised it maybe 2 or 3 months before the exam, but somewhere in the past I have heard it, and I could guess that it has to be B or C. So I used to get it correct 50% of the times. And of course there are some questions where you just have to make an intelligent guess that if some dose is asked, you know that the answer can't be in milligrams for this drug, or it can't be in grams for this drug. So you can easily rule out 2 options, then it's just a value. So that's a luck based question.
Okay. Now, students who are currently undergrads,
yes,
what is your message to them?
For the undergraduates, I would just like to say that read your standard textbooks. If you are a foundation student, attend your classes, make good notes, because those are the things that you are going to read a month before your exam. I mean, if you are referring to MCQ books or the damn CRS theory, you cannot read the entire CRS textbook 1 month before NEET. And as many revisions as you do is what determines your rank, because there you have to guess the answer within 10 to 15 seconds for most of the questions. Only then you can come to the long case-based questions, or questions where you need to apply 2 or 3 subjects, integrated questions. So for that you need at least 3 to 4 revisions, and for that you need something that is very concise. So I think that was the point where DAMS helped a lot, because the foundation course notes and whatever updates I had added from the club, they made the revision very easy. So I could complete the final revision within 1 month. That was my 3rd revision.
Okay. Now, last, where do I see Shalin in the next 10 years? What is he going to do with his great rank?
My passion is ophthalmology, so I plan to take MS ophthalmology. After MS, I plan to pursue a fellowship. So after 10 years, I see myself as a good ophthalmologist practicing either in a government, either as a full-timer in a government hospital or as a private practice at my hometown.
So probably we have Shalin, who has probably opened our eyes, and he is now again looking into take up ophthalmology to make the world more beautiful the way we look. Congratulations, Shalin, because it was a very rapid fire talk from your side where we could understand as a student probably where we can make a difference to become the next Shalin probably in the next year or in the coming years, because you have been a role model to many of the students, being a fresher, an intern from KEM, having a lot of pressure, having regular classes, but still cracking the exam. Yes, we congratulate you. all the best, buddy. Do well
Thank
and enjoy your life. Okay. Thank you.